Sophie Sykes and Jane Mitchell are presenting Senate Bill 2532 and House Bill 2641. The time is right for Tennessee to join the rest of the nation and pass the legalization of medical cannabis. We are facing major social issues in our state today. We are experiencing an ongoing opioid crisis as well as unfair criminal charges for nonviolent crimes against small possessions of marijuana and the racial injustices linked to those charges. We need to advocate for the rights of the suffering by legalizing medicinal marijuana. The proposed bill presents a medical cannabis program for authorized patients and appointed caregivers, which allows the possession of specific medical cannabis products. If passed, this bill will allow an alternative medicine that will benefit numerous conditions as well as lower the number of opiate prescriptions given out annually. It will also open the door to fight against decriminalizing the stigmas around marijuana. In the nation, on average, 9 out of 10 arrests are for possessions of marijuana. Tennessee is one of the 19 states that still permits arrest over small possessions of cannabis. We are not only seeing an issue with nonviolent criminal charges being made, but as well as racial disparities. Tennessee's racial disparity is 3.2 times more likely to arrest a black person versus a white person with possession of marijuana. While legalization does not eliminate disparities, it dramatically reduces the total number of cannabis arrests. With that being said, we are making small improvements. Several district attorneys across the state are no longer prosecuting a low-level marijuana possession. District Attorney Glenn Funk stated, "Marijuana charges do little to promote public health and even less to promote public safety." Along with an unjust criminal system, Tennessee is also facing an ongoing opiate crisis. We as a state are number 2 in the nation for opiate use. Based off the annual overdose report for the state of Tennessee, over 5 million opiate prescriptions were filled in 2020, and 16.9% of the prescribed opiates were related to an overdose. This is an endemic that we need to address today. Studies found that when a state instituted any medical cannabis law, prescriptions filled for all opiates decreased by 2.1 million daily doses per year. By utilizing other forms of medication, we can potentially aid to decrease the harmful overdosing of opiate prescriptions. Although further studies still need to be conducted for long-term side effects of marijuana, this policy has great benefits. It will not only provide an alternative medicine to opiates, but it will also help treat many different conditions such as epilepsy, chronic pain, PTSD, and much more. Out of the 50 states, 37 states have legalized the use of medical marijuana. Tennessee is one of the only 13 states left to pass this bill. We need to catch up to the rest of the nation. We have seen the economic feasibility across the nation that already have these policies implemented and the benefits that come with it. Data has proven that the states that legalize marijuana have benefited from tax collections. Research has proven this bill's financial stability for many states and its future potential for Tennessee. Of course, there are limitations. This bill only includes the possession, not the growth and production of marijuana, which will not allow great tax revenue that most states have acquired. This bill also does not discuss the possession charges that are still applied in many districts today. With these limitations, this policy has greater strengths that will benefit Tennessee. With this policy, it has the potential to alleviate the opiate abuse we face today, as well as being able to treat many different conditions without the dangers opiates can cause. Here are some recommendations to consider when implementing this bill. If we want to ensure for the safety and overall well-being of the citizens of our state, we need to have plans that uphold oversight of this bill. By executing a state-run program that will oversee the use of each cardholder, as well as implementing proper education on cannabis, we can guarantee a better control of possible misuse. With the passing of this bill, it will open new doors for Tennessee. Future bills of possible full legalization of marijuana can lead to strong profit margins and decriminalizing the possession and use of marijuana. This will allow our state to utilize our resources on more serious offenses to better our community, as well as bridging the gap between racial disparities with criminal arrests. This bill aligns with the NSAW core values, specifically including social services, dignity and worth of a person, and our fight against social injustices. As social workers, we must fight for our community to encourage for a bill that will benefit the overall health of our state. The time is right for Tennessee to join the nationwide movement by legalizing medicinal marijuana.